Every once in a while, my heart seems to be jumping out of my chest and I get a weak feeling and short of breath, the patient explained. When I listened with my stethoscope, his rhythm was different than the usual lub-dub foot tapping sounds, which are regular as a band marching through town on a summertime parade. Instead, his heart had the irregular rhythm of popping corn, chaotic and unpredictable, and I couldn't tap my foot to it. As predicted, the EKG showed the rhythm of atrial fibrillation, with the atrial rate running 300 to 400 beats a minute and the ventricular rhythm, chaotic as experts say, irregularly irregular, at about 150 beats per minute. Atrial fibrillation, or AFib, is the most common abnormal heart rhythm condition. It afflicts about 1% of the total population, more than 2 million people in the US, and 8% of all those older than 80 years of age. There are many causes for atrial fib, including long-standing high blood pressure, coronary artery disease, sleep apnea, too tight or too loose heart valves, too much or too little thyroid hormone, blood clots to the lung, and an inherited conduction system or wiring condition, excessive amounts of tobacco, coffee, alcohol, or amphetamine, a viral infection involving the heart, stress of any kind, or just an old, weak heart. There are two main reasons we need to do something about this rhythm abnormality. Most devastating can be the clots that can form in the atria since they're not emptying effectively, resulting in something like 10 to 25% of all the strokes that occur to the brain. Second, the ventricles are not efficient pumps when the atria are fibrillating, and even worse when they're running at about 150 beats per minute. So with atrial fib, we have to slow the heart rate down, thin the blood to prevent strokes, and sometimes even bring the rhythm back to normal when we can. While we're at it, physicians need to study why atrial fib happened in this particular case. It's a complex and interesting condition, and there are a lot of debate about what kind of blood thinners to prescribe, what kind of rhythm-controlled drugs to use, and when to use fancy surgery and pacemaker treatments. But the bottom line about atrial fib is that good treatment by your general or cardiology physician can prevent problems and allow a normal life, even with the heart rhythm as irregular as popping corn.